Angina. Introduction.
All people who have angina feel the same symptoms.
Select true or false.
Correct. Angina may feel like heaviness, indigestion, or other types of discomfort in the upper body or arms. Angina pectoris usually happens after exercising or exerting physical effort, like climbing the stairs.
Select true or false. Correct. Angina pectoris usually happens after exertion.
Please point to the coronary artery.
Choose one of the following options.
Correct. The coronary artery provides blood that is rich in oxygen and nutrients to the heart.
Coronary artery disease is the only cause of all cases of angina. Select true or false.
Correct. Most, but not all, angina is caused by coronary artery disease. Fatty substances cause the plaques that block the coronary arteries.
Select true or false. Correct. Fatty substances such as cholesterol cause blood vessels to become narrow, but smoking and high blood pressure speed up the blockage process. Andrew is climbing the stairs. He feels short of breath with pain in his chest and left arm. He rests and the pain goes away within 5 minutes. Is this more likely angina or a heart attack? Choose one of the following options. 1. Angina. 2. Heart attack. Correct. It is most likely stable angina because resting stopped the pain. Andrew should check with his healthcare provider about the pain as soon as possible. Linda has stable angina. When she feels chest pain, she takes angina medication and feels better soon. Today, and as she is walking, she feels pain in her chest. The pain is stronger and different than usual. She rests and takes her medication, but the pain does not go away. Is this a sign of a heart attack? Select yes or no. Correct. It is most likely a heart attack because resting and medication did not stop the pain. Linda should seek immediate medical care. While Linda is reading a book, she develops chest pain. The pain lasts 5 minutes, then disappears. Is this more likely a heart attack? Select yes or no. Correct. It is most likely not a heart attack because the pain only lasted 5 minutes. This pain could have been angina.
After surgery, coronary artery disease is cured.
Select true or false.
Correct. Surgery opens the clogged artery or bypasses it to let blood flow more freely. Adopting a healthier lifestyle will help control the coronary artery disease. A nitroglycerin tablet will not help relieve angina as fast if swallowed.
Select true or false.
Correct. Nitroglycerin tablets work immediately only when dissolved in the mouth, which is the quickest way for the nitroglycerin to be absorbed into the blood. Some people who smoke do not have coronary artery disease.
Select true or false. Correct. Some people who smoke do not have coronary artery disease, but middle-aged smokers are 3 times more likely to die from heart disease than non-smokers. Thank you for using Explain.